Hello everyone! Welcome back to our channel. Today, we're diving into an important topic that affects many people, but often doesn't get the attention it deserves: vaginal infections. We'll cover what they are, the different types, symptoms to look out for, and most importantly, how to prevent and treat them. So, let's get started. First, let's talk about what vaginal infections are. Vaginal infections, also known as vaginitis, are a common issue that can affect anyone with a vagina at some point in their life. They occur when the balance of bacteria and yeast in the vagina is disrupted, leading to inflammation, irritation, and infection. A healthy vagina has a balanced mix of bacteria and yeast, which helps maintain its natural pH level. When this balance is disturbed, it can lead to an overgrowth of harmful microorganisms, resulting in an infection. Now, let's discuss the most common types of vaginal infections: bacterial vaginosis, yeast infections, and trichomoniasis. Bacterial vaginosis, or BV, is the most common vaginal infection. It occurs when there's an overgrowth of certain bacteria in the vagina, which disrupts the natural balance. BV is often characterized by a thin, grayish-white discharge that has a fishy odor. Some people might also experience itching or burning, but others may not have any symptoms at all. Risk factors for BV include douching, having multiple sexual partners, and using scented vaginal products. Treatment usually involves antibiotics prescribed by a healthcare provider. Next up, yeast infections. These are caused by an overgrowth of a fungus called Candida. Yeast infections are very common and can cause a lot of discomfort. Symptoms of a yeast infection include thick, white discharge that resembles cottage cheese, intense itching, redness, and swelling around the vulva. Some might also experience pain during intercourse or urination. Yeast infections can be triggered by factors such as antibiotics, hormonal changes, uncontrolled diabetes, or a weakened immune system. Over-the-counter antifungal treatments are available, but it's always best to consult with a healthcare provider for proper diagnosis and treatment. Finally, let's talk about trichomoniasis, or TRICH for short. This is a sexually transmitted infection caused by a parasite called Trichomonas vaginalis. TRICH can cause symptoms like a frothy, yellow-green discharge with a strong odor, itching, and irritation. Some people might also experience pain during intercourse or urination. Trichomoniasis is usually treated with a single dose of antibiotics, but both partners need to be treated to prevent reinfection. Prevention is key when it comes to vaginal infections. Here are some tips to help you maintain a healthy vaginal environment and reduce your risk of infections. Maintain good hygiene. Wash the genital area with mild, unscented soap and water. Avoid douching, as it can disrupt the natural balance of bacteria in the vagina. Wear breathable cotton underwear and avoid tight-fitting clothing to reduce moisture buildup. Practice safe sex by using condoms and maintaining a monogamous relationship if possible. Limit the use of scented products, such as tampons, pads, and sprays, which can irritate the vaginal area. Stay hydrated and maintain a healthy diet to support your immune system. Avoid prolonged use of antibiotics unless prescribed by a healthcare provider, as they can disrupt the natural balance of bacteria. If you do experience symptoms of a vaginal infection, it's important to see a healthcare provider for an accurate diagnosis and appropriate treatment. Self-diagnosing and treating with over-the-counter products might not always be effective and could potentially worsen the condition. Treatment for vaginal infections varies depending on the type of infection. Thank you for joining us today and learning about vaginal infections. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Don't forget to subscribe to our channel for more health tips and information.